Have you ever felt a sudden pain in your head, like a tight band or a heavy weight? We call it headache. But have you ever wondered why it actually happens? Today I am going to explain headache in the most simple, clear, and impressive way. Let's begin. A headache is basically a warning message from your body. Your brain cannot feel pain, but the nerves, blood vessels, and muscles around your head can. When something irritates them or puts pressure on them, they send a message to the brain saying something is not right. And this message appears to you as pain, which we simply call a headache. Now, why do we get a headache? Think of your head as a busy control center. If anything disturbs its balance, it reacts. You get a headache when your muscles become tight, your nerves get overactive, your blood vessels expand or shrink. Your body needs rest, food, or water. When these things happens, the head sends a signal, and that signal is a pain. Common causes of headache. Number 1, stress or tension. When you feel stressed, worried, or think too much, the muscles in your head and neck become tight. This tightness puts pressure on the nerves, and that pressure causes a headache. Number 2, dehydration. Not enough water. If you don't drink enough water, your body becomes dehydrated. This affects the blood flow to your brain and leads to pain, which you feel as a headache. Number 3, lack of sleep. When you don't sleep properly, your brain does not get enough rest. A tired brain becomes sensitive and gets irritated easily, which results in a headache. Number 4, skipping meals. If you skip meals, your blood sugar drops. The brain needs a constant supply of energy, and when it doesn't get it, you start to feel a headache. Number 5, too much screen time. Using your phone, computer, or TV for a long time strains your eyes. This eye strain activates the nerve around your head and causes a headache. Number 6, loud noise or bright light. Bright lights or loud noise overstimulate your brain and nerves. When these nerves become overloaded, they respond with pain leading to a headache. Number 7, hormonal changes, especially in females. Changes in hormones during periods, stress, or other body changes can trigger headaches. Number 8, cold, flu, or sinus problems. When you have a cold, flu, or blocked sinuses, extra pressure builds up inside your head. This pressure causes discomfort and leads to a headache. How to feel better when you have a headache? Drink a glass of water, rest your eyes, and lie down for a bit. Massage your temples, reduce screen time, eat something light, sit in a quiet or dark room. Take slow, deep breaths. This action relax your nerves and help the pain go away. A tension headache is the most common type of headache, and it feels like your head is being squeezed by a tight band. Imagine the muscles around your head and neck getting tight and stiff, just like a rubber band being stretched too long. When these muscles tighten, they pull on the nerves around your head. Those nerves don't like being pulled, they respond with pain. This pain is spread across your forehead, temples, or the back of your head. How it feels: a tight band around your forehead, heavy pressure on your temples, stiffness in your neck. Mild to moderate pain, not usually throbbing. It doesn't feel like something is beating inside your head. It feels more like something is pressing or tight. Why it happens? It happens because of stress, tiredness, long screen time, poor posture, lack of sleep. How to feel better? Close your eyes and take slow deep breath. Massage your temples and the back of your neck. Drink water. Give your eyes a screen break. Stretch your neck gently. Sit in a quiet, comfortable place. A migraine is not just a regular headache. It's a special kind of headache that can feel very strong and throbbing, often on one side of the head. Imagine your brain's nerves and blood vessels are overexcited, sending constant pain signal. That's what happens during a migraine. It can last hours or even days, unlike normal headaches. How it feels: throbbing or pulsating pain, usually on one side, sensitivity to light, sound, or smell, feeling nauseous or wanting to vomit, sometimes blur vision or seeing flashing lights. Why it happens? It happens because of stress, hormonal changes, certain foods, sleep changes, sensory overload, and dehydration. How to feel better? Rest in a quiet, dark room. Close your eyes and relax. Drink water. Apply a cold compress to your forehead. Avoid bright lights and loud noises. Sometimes medicine may be needed if pain is severe. A sinus headache happens when your sinuses, the hollow spaces in your forehead, cheeks, and around your nose, get inflamed or blocked. Think of your sinuses like small air filled rooms in your face. When they get filled with mucus or get swollen, the pressure builds up. This pressure pushes on the surrounding nerves and tissues, causing pain in your head. How it feels: pain and pressure around the forehead, cheeks, and nose. Pain worsens when you bend forward or move your head. Congested nose, runny nose, or feeling of fullness in your face, sometimes accompanied by fever or cold symptoms. Why it happens? Because of cold or flu, allergies, sinus infection, air pressure changes, and nasal blockage. How to feel better? Drink warm water and fluids. Use a warm compress on your forehead or cheeks. Inhale steam to clear sinuses. Rest in a comfortable position. Treat allergies or infections if needed. Avoid sudden pressure changes if possible. A cluster headache is one of the most intense type of headache. It's called a cluster headache because the attacks happens in groups or cycles, sometimes for weeks followed by periods of no pain. Imagine a sudden sharp burning pain behind one eye or one side of your head. It is so severe that many people describe it as the worst headache they have ever felt. How it feels: intense pain on one side of the head, usually around one eye. Pain comes in short bursts but repeats frequently over hours. The eye on the affected side may tear up or become red. Nose may run or become blocked on the same side. Restlessness: people often pace or move around because the pain is so intense. Why it happens? It happens because of abnormal brain signals, blood vessel changes, triggers. How to feel better? Inhale pure oxygen if available. Avoid alcohol and smoking during cluster periods. Rest in a dark, quiet room. Medication prescribed by a doctor can help reduce attacks. Cluster headaches are very painful, so seeing a doctor is recommended for proper treatment. Hypertension headache happens when your blood pressure rises too high. High blood pressure puts extra force on your blood vessels, especially those in your head, and this pressure irritates the nerves, causing pain. Think of it like a pipe under too much pressure. When the pressure is too high, the walls strain and your head feels it as a headache. How it feels: usually a pulsating or throbbing pain, often at the back of your head or around the temples. feels like a pressure building inside the skull, sometimes accompanied by dizziness, blurred vision, or nausea. Pain is often worse in the morning. Why it happens? It happens because of high blood pressure, that is, hypertension, stress or anxiety, poor diet or salt intake, obesity or lack of exercise, and underlying medical conditions. How to feel better? Sit quietly and rest. Take slow, deep breaths. Drink water, but avoid excessive caffeine or alcohol. Follow a healthy, low, slow salt diet. Exercise regularly. Monitor your blood pressure regularly. If headache is severe or sudden, see a doctor immediately. So, whether it's a tension headache, migraine, sinus headache, cluster headache, or a headache caused by high blood pressure, remember one thing: your headache is your body's way of saying, pay attention to me. Listen to your body, stay hydrated, get enough rest, manage stress, and take care of your health. And if the pain is severe or unusual, don't ignore it, always consult a doctor. Headache may be common, but understanding them makes you stronger, healthier, and more in control. If you found this video helpful, don't forget to like, share, and subscribe for more simple and impressive health tips. Take care of your health because it takes care of you.